Hello everyone, and welcome to this audio podcast. This audio podcast as part of the Equipoise. This audio podcast as part of a Labstorm Motley. This audio podcast as part of a Storm and Scuttle and Turbulence. This audio podcast as part of the Squakish and the Squakish Series and Audition. This audio podcast as part of a Storm Robotics production. In this audio podcast, a sort of a look at uh, at um, at in around sort of aspects in around electronic patient records or EPRs, and also additionally aspects in line to information, some information or some basis in around what is referred to as point of care, in around point of care. To begin with, a little bit of intro. Uh, physicians or physicians physicians or clinicians tend to gather information from recipients or patients in the form of answers to questions, patient stories, physical examinations or clinical histories, and in around a link with investigations, laboratory analysis and investigations in around particular symptomologies for clarity in around for clarity for in around particular illnesses or conditions. Physicians additionally tend to or clinicians tend to integrate sort of insights with what they know about recipients or patients, and in around sort of family histories, family history. Additionally, and especially in around, for example, genetic anomalies, or genetic predispositions, and also information or insights in from sort of medical texts or clinical texts, and through colleagues and peers and other resources. Additionally, physicians or clinicians tend to develop sort of plans, clinical or medical plans, or sort of care plans, following sort of evaluations and sort of following sort of evaluations, and in by communicating with and through sort of other parts other teams, in as part of healthcare, of a healthcare system or healthcare systems. This all then links into what's referred to as electronic patient records, or EPRs. Now, each healthcare system can have different sort of EPRs. In some parts of the world, for example, EPRs can be accessed by healthcare professionals, but also by healthcare service users. In some parts of the world, for example, EPRs can only be accessed by healthcare professionals. This sort of flow of information can be helpful, but in as part of modern society and modern EPRs, at the same time, unfortunately, can form a sense of expense, or there can be a sense of expensiveness in around this, because of how data is is and can be how and how data can be it can be and is used. Physicians and clinicians and other healthcare professionals or frontline healthcare professionals particularly can spend more than one third of their time in around synthesizing that particular informations in around services or healthcare service users. Uh, at the same time, further comms can tend to cause sort of can sort of cause challenges, let's say challenges in around a sort of healthcare service budgets, irrespective of, for example, primary care healthcare services or secondary care healthcare services. So now, looking at a little bit more in around this and where EPRs in context of POC or point of care. So service users or healthcare service users can have various questions relating to, for example, in around kidney care or nephrology care following routine clinical appointments. Owing to the lack of opportunities to share real life experiences with where healthcare service users sharing real life experiences with other healthcare service users in around the same or similar symptomologies through, for example, face to face communications. For example, it is where the RPSG, the Renal Patient Support Group, was founded in 2009 to help primarily raise chronic kidney disease awareness for and in amongst the adult CKD population. The RPSG sort of founders intended the RPSG platform, to offer online support of online and centric sort of healthcare service user support as part of kidney care received, and primarily at the time for healthcare service users in the southwest of the United Kingdom. However, the RPSG team identified that healthcare service users utilizing the social media platform were actually accessing from various parts of the globe, owing to the variety of shared sort of experiences, which led to opportunities for many to additionally gain insights into a shared decision healthcare in around insights into different healthcare services, but also ultimately where shared experiences or shared lived experiences are sort of encourage healthcare service users to also sort of have a basis in around shared decision making. This social media platform also offers opportunities for healthcare service users, healthcare professionals, and investigators or researchers to work collaboratively and in partnership. The international reach has actually enabled those utilizing the social media platform to have an increasing understanding of chronic kidney disease, or chronic kidney disease, including the disease process, symptomologies, and care plans. Uh, to iterate here, our listeners and viewers, that care plans or healthcare service plans differ. They differ. So, for example, in one region of the world or a part of the world, a healthcare service users may experience different healthcare plans in around for example, around a symptomology in around kidney care or nephrology service versus another part of the globe another part of the world, owing to where unfortunately there can still be health inequalities that sort of coexist as part of our healthcare services. So whilst the RPSG does not formally provide or offer clinical or medical advice, or it has not retrospectively, it does provide and offer CKD patients a sort of space through the social media platform. There has also been a trend to use technology in the form of, again, in the form of EPRs, or electronic patient records, to bridge gaps in healthcare, such as peer support, healthcare peer support, and in around education. But further investigations, some further investigations in amongst a link between the literature and in amongst how in around a POC, a point of care, is actually embedded in amongst healthcare services. Healthcare services, sort of more generally. In this context, there is also a requirement or a need to evaluate different guidelines for and in around aspects pertaining to patient and public involvement, and a focus on and where, for example, commissioning or healthcare commissioning is required. A few areas that could be important, could be important link sort of EPRs or EPR use, electronic patient record use, aligned to e-health and e-learning, wherein healthcare service users and healthcare professionals co-develop or co-produce initiatives. At the same time, to close on this audio podcast, the UK government in the past has emphasized the importance of tech, different aspects of tech, in improving healthcare and healthcare outcomes, and providing or offering smarter patient-centric care. Such initiative would be important, or could be important to healthcare documentation, that already sort of exist as part of EPRs, electronic patient records. That draws this audio podcast to a close. This audio podcast as part of the Equipoise. This audio podcast as part of a lab storm motley. This audio podcast as part of a storm and scuttle and turbulence. This audio podcast as part of the Squakish Series and or edition. And this audio podcast as part of a Storm Logistics production.